about the vaccine for tuberculosis. So where we have reached?
So vaccine for tuberculosis has been a more elusive target. We did one of the largest trials of two vaccines that we thought had good promise. However, they did not turn out to be as good as we had thought. But now we are working on three other candidates, and one of these vaccines is going to be made in India, and it is almost ready for clinical trials. And this vaccine, we will see if it is more beneficial. It looks like the early data on that from phase 2 studies appears that this vaccine will be more effective, but the country is working towards that. And there is another vaccine which we are trying to also develop in India based on a technology transfer of the antigen, but then adding the adjuvant in India. But that is a little far ahead. So I would say vaccine work is ongoing, but at the moment today we don't have a usable vaccine other than BCG. BCG is the critical vaccine for children. It must continue to be used, and we are looking for the vaccine which will also prevent TB in adults.
Sir, one of the major issue which is related to the health is air pollution these days. Are you doing some research work regarding this?
Definitely, we have looked at several health aspects of air pollution and how it can be reduced. We are also looking at the effectiveness of certain interventions which are individual, for example, which is use of air purifiers in those patients who have heart disease and are at a greater risk of ill effects of air pollution. But this is a very, very important topic for research. We have funded several projects in not only to find causes of air pollution so that they can be tackled by different agencies, but also how to mitigate the effects as much as possible, whether it is at an individual level or it is at the community level. We continue to provide all the data and information around these issues, which are the health impact of certain of the air pollution and what effects it is having on our health. And there are several efforts of the government to control and reduce, as you might already know.